over um, some path and some physiology that you might need to refresh yourself on. So feel free. This won't take very long. The law, I will end the session when there's no more questions. Okay, so feel free to ask as many questions as you need. Okay, so week one, we talked a little bit about the risk for um, pregnancy. And we talked a little bit about knowing and interviewing a patient and getting her history. But I want to touch on just some basic physiology today because we don't talk about it much in week one or two. We talk about changes during pregnancy, but just the, let's see, what's this? But here we go. All right, there we go. But we don't really talk about basic physiology because you might not remember it. It's been a while since you took it, right? So let's talk about, in particular, the cardiovascular system, because we know that there's a lot going on there. Let me go back up here. So the concept of perfusion. In your mind, what is it? Can somebody tell me what it means? Anybody?
Isn't it
Just
something like how the blood is distributed through the body and stuff like that?
Yeah, it's exactly how the blood is pushed out to all the organs and tissues and ultimately at the cellular labor level. So why do we need blood to reach all areas? Why do we need blood? What is it about the blood that is important to get to
Oxygenation.
oxygenation? What
Yes.
else?
To provide what are electrolytes and stuff like that's water. So
Yeah, yeah,
yeah.
everything that we need comes through our blood. The life is in
Yeah.
the blood. I don't know
Mhm.
if you've ever heard of that. So oxygen is there, nutrients or broken down nutrients, all the electrolytes, all the minerals that we need for functioning, right? All the information that the cells need to do their job. Okay, so totally relied on blood. The blood will also pull away waste products. It pulls away fluid, it pulls away carbon dioxide, so it can be um, um, the kidneys will filter it, but it has to be regenerated. So it has to go through the lungs and the kidneys to remove all those things. Okay. So that's what perfusion is naturally. So we have to have a pump, right? We have to have electricity. We have to, heart has to be beating the right rate and pushing out the right amount to get the blood to the complete periphery. Okay. So when it goes through the lungs, do you remember the little alveoli out in the periphery of the lungs? That's where the gas exchange takes place. So we take a deep breath and pull in mostly oxygen. There's other things. Nitrogen is in our atmosphere too. Goes into the alveoli, and then the blood picks up the oxygen from that alveoli. It just diffuses across. It doesn't require any energy. It just sneaks through and gets into the blood. Okay, and then the carbon dioxide comes from the veins back into the alveoli, and we exhale it. Okay, so that is gas exchange, and we need that to get the oxygen. Okay. Um, all our blood vessels need oxygen. Um, the red blood cells are what carries that oxygen, in particular, the hemoglobin molecules on the red blood cells. That's where the oxygen is found, and it's dropped off wherever it's needed. We're going to talk about perfusion when it comes to placenta, but it's a different kind of circulatory system. Okay. So let's look at what else is in the blood besides oxygen. So we have components. We divide the components up in basically two parts. We have plasma and we have red blood cells, right? They're all mixed together, but those are the two major components of the blood. Okay. The red blood cells, um, the leukocytes, and the platelets. So we have coagulation factors in our blood as well. It shows here in the plasma, we've got albumins, globulins, which are protein. It's a broken down form of protein. Globulins is for our immune system, fibrinogen, prothrombin. Those are all the coagulation factors. And then we have, somebody mentioned minerals. We've got the ions, gases, and then regulatory substances. Okay, so um, that is what our bloods make up. Now, one thing is that during pregnancy, this changes a little bit. Okay? There's a lot more plasma during pregnancy. In fact, there's almost twice as much plasma during pregnancy and a few more red blood cells. The red blood cells might be a little larger during pregnancy. And then some of the clotting factors are actually increased during pregnancy. So she is going to be able to clot her blood easily during the postpartum period. But what happens when there's more clotting factors is there is an increased risk for deep vein thrombus in the lower extremity, a blood clot. So that's part of the risk. Okay. So let's go to the cellular level, how fluids move. Okay, you know the interstitial fluid. This is the fluid that's outside of the blood vessels and between the cells. Okay, it's all the extra interstitial fluid. Okay, and then you have intravascular fluid, and that's the blood and everything else in the blood. Okay, and then you have fluid inside the cells. So there's three different compartments, and water will follow sodium. Okay, if there's low sodium in the blood vessels, then water will uh, uh, move out of the blood vessel into the interstitial space. Okay, if we have a diabetic, then we have a patient that has extra glucose. If they're not controlling their glucose, we have extra glucose in the red blood in the intravascular space, and that pulls fluid in. Okay, and it requires energy to pull the glucose from the blood vessel to the cells. Okay, so gases move by diffusion, as I said. Carbon dioxide, nitrogen, and oxygen just move right across the cells, but everything else has to require energy. All right. So we already talked where the oxygen in the blood comes from. Let me go back up here. Ask you a question. Okay, never mind. So this is just I want you to keep in mind during this class that there are blood vessels all over our bodies, right? They're everywhere because we have to have blood get into every cell. So it's not just the heart that we worry about. It's not the big aorta we always worry about. We also have to worry about all the other organs. And for example, in this picture I have pulled up here, and it doesn't look quite right. Let me pull it back up. The uterus, right down there. I added that in there to that picture. So we have to have good perfusion of the uterus. Um, why? Why do we need good perfusion of the uterus? For a pregnant woman.
To provide oxygen to the baby.
Yeah, yeah, that fetus needs everything that mama's getting.
Yeah.
I mean, not it needs oxygen and get rid of the carbon dioxide. It needs amino acids. It needs all those electrolytes for that system. So we've got two systems up and running. So we have to make sure the blood gets to the uterus. And so gets to the uterus by the main aorta. And then it branches off into the iliac arteries and then the uterine artery to get to the uterus. So here's just a picture. You can see the aorta, and then you can see different branches from the iliac and from the aorta reach the uterus to feed the uterus and to remove waste products from the uterus. Now, now that we have a baby, and there's a picture all the way to my right of the uterus and the placenta. So the placenta is actually attached to the wall of the uterus so it can implant itself to receive the oxygen and the nutrients from the uterus, from the blood that's circulating to the uterus. And then the placenta will then feed the baby. Okay, so it comes from mom, from her heart, makes its way down the aorta to the uterus, and then the placenta is attached to the uterus, so it gets its system, and then it goes to the baby. The blood doesn't mix, and we will talk about that. It's filtered. The placenta actually does the exchange, kind of like the lungs do. So the um, oxygen and carbon dioxide just make it across from the uterus to the placenta, and then from the placenta to the umbilical vein, then to the fetus. Okay. So the fetus, when you think about it, the fetus then is totally dependent upon the uterus having adequate blood flow, adequate blood pressure and amount. So if mom is losing blood somewhere, the fetus is going to suffer. If mom is not well oxygenated, the fetus will suffer. If mom is not eating right, the fetus will suffer. The fetus is totally dependent upon mom's blood to bring the nutrition and everything else he or she needs. That's a really important concept because we're going to be talking about supine hypotension. Anything that reduces blood flow to the uterus is going to put the baby at danger, at risk. So when you think about um, anemia, if mom doesn't have enough iron, the baby's not going to have enough iron. If the mom is smoking cigarettes, that nicotine reduces blood flow. It actually causes arteries to squeeze down a little bit. So the blood flow isn't as good. Baby should be fine, but what happens is that the nutrition is not going to get to that baby as well. So women who smoke, they have small babies. Okay. If they're smoking one or two cigarettes a day, not necessarily so, but a regular habit, whatever that amount is, they're going to have small babies. An adolescent who maybe not might not be eating well, she still needs good nutrition herself. She's still growing, so her baby might suffer. The old wives' tale or the myth that baby will take everything it needs from mom is not true. It's not true. Mom's needs will be met first. The baby is the one that suffers. Substance abuse, alcohol, all of those substances will reach the fetus. There's not many things that will not be exchanged by the placenta. Insulin won't go across, but just about everything else will go across. There's a lot of toxic um, uh, environmental toxins. Anything mom's exposed to, baby is exposed to. Any questions about the physiology?
I have a question.
Yeah.
So I mean, this might not make any, it might be a dumb question, but so will the baby like feel like similar effects, or they'll just get like the toxins and like all that stuff, like, or how does that work? Like,
What was the first part of your question?
like, does the baby feel similar effects? Like, let's say if a mother has like takes a narcotic, will it be like the baby also feels the same things, or how does
Yes,
that work?
yes. Yeah,
Oh,
drugs will cross through over into the placenta as well and get to the fetus. Drugs do. Hmm?
okay. Oh,
So
interesting.
there's some drugs that mom can't take during pregnancy. Aspirin, okay,
Right.
aspirin, except maybe a diabetic, a very low dose aspirin, or someone with lupus, but not normally. No ibuprofen. No ibuprofen. Tylenol is safe during pregnancy. There's no scientific evidence that it's not. We've been using it for years. We give it to newborns, okay? So they can handle acetaminophen. But they're, like cannabis, that'll reach baby. Any of your opioids or opiates will reach baby. Any of those things. Cocaine will reach baby. Yes. The placenta will not filter out any of that. It won't filter any toxins. So if mom gets rubella during pregnancy, baby's exposed to it, and that causes hearing problems and other dangerous things. Okay. So remember, the blood doesn't mix. And I really should pull up a picture of how it works. But if you look at this picture of let me see if I can find one. Let me see if I can find one. Hold on just a minute. Oh, let's see here. Okay. I don't know why it's not coming up. Oh well, I'll get it back to you. Okay, we'll just go back. So yeah, I have pictures of a placenta, and your book does too. And in fact, for my students, I actually have a video posted in our second week about placental physiology and circulation. Okay. Any other questions? What do you think would happen? So a fetus during pregnancy, heart rate is usually between 110 and 160. That's a normal heart rate for a fetus. Fast, very fast. Let's say mom is laying flat on her back and she's very pregnant and she's got this baby in her belly, plus a lot of amniotic fluid. Plus, the uterus itself grows. It actually grows more cells during pregnancy. So there's a lot of weight that's on her belly when she's lying flat. Do you remember the picture I showed you back here? Let me go back here. This picture, the aorta, and there's also the inferior vena cava that travels right along with it. And it's usually laying on the right side of against the aorta. If she's laying flat on her back, that will actually compress her vena cava because of the weight of the baby. So it reduces blood flow back to the heart. If we're compressing the vena cava and the blood is going back to the heart, you've got a heavy baby laying on top of it. It actually squeezes the inferior vena cava, which reduces blood flow back to the heart, and that blood flow is reduced to her brain. And the blood flow to the baby then is reduced. So what you're going to see, clinical signs of supine hypotension, if she's laying flat on her back, the clinical signs would be mom feels dizzy. She might even be nauseous. She might pass out, okay? Because the blood flow back to the heart is not sufficient. What happens to the baby? The baby's heart rate actually drops below 110. We call that deceleration of her heart, of the heart. So we don't want her lying on her back. So we roll her on her left side away from the vena cava so that can fill back up. And baby's heart rate can go back up, and mom's blood pressure will go back up, and her dizziness will go away. So mom's blood pressure drops. It's called supine. She's laying flat on her back, supine, and the baby is crushing that vena cava. It's called supine hypotension. Mom gets her blood pressure drops, and then the blood flow to the baby is not sufficient. So the baby's heart rate drops. Okay, it's a snowball effect. Okay, that's really one thing that's important for you to understand. Anything that reduces blood flow to the baby, it's harmful to the baby. So not only nicotine and substances, but low blood volume, like I talked about at the very beginning, or anemia, nutrition, and believe it or not, chronic hypertension reduces blood flow to the baby. If the pressure is too high, because within the placenta itself, we need for that pressure system, the placenta to be lower. We need plenty of blood to come in. I really wish I had those other pictures. I can't get it to come up. But we'll be talking about that this week. And I know all the other instructors will be talking about placental blood flow. Any other questions? All right. Let me look at something. How many of you gotten into this week's content, week 2 content? Anybody? So those of you who have class tomorrow, you have a quiz, right? This week? Some of you have class, med-surg, and OB in one day. I know that. Okay, so it's kind of tough. I hope you've been able to work on, let's see, your information. Quiz 1 is this week. So,
So I have a question.
yes,
So the quiz 1, it's over week 1 content. Right.
most of the quiz is over last week's content. So
But
like
some of it is over week 2's content.
2 questions are going to be from this week's content. Okay. So, what are some things you remember from last week that we really tried to stress?
Disparity.
Okay. We talked about disparity. Um, what else did we talk about that was really important?
Acculturation, assimilation.
Okay. And we talked about high risk pregnancies a little bit, didn't we? Which groups of women, which maybe chronic histories, or some kind of background that puts her at high risk. You remember talking about that?
Oh, colored women.
Okay, women of color. Yeah. Um, there's one math question on here. Okay. And then somebody tell me um, about the how fertilization occurs. Kind of tell me what's going on when. You don't have to know exactly, but just kind of tell me how it begins.
It starts in the fallopian tubes.
Okay, what's going on in the fallopian tubes?
Um,
The sperm penetrates the egg.
Okay, okay, so yeah, that's where the conception usually occurs, or fertilization. Those words are used, um, exchange the back and forth. Okay, so usually the sperm will impregnate that egg in the outer one third. In other words, closer to the ovary, then closer to the uterus. Okay, and then what happens?
The zig zygote is formed. I think that's how you say it.
Zygote. Zygote.
Zygote.
That is the conception. When mom and mom's egg and the sperms unite, they both bring a set of chromosomes. And that is when life is started. Okay. And that is when the DNA should be, if it's a normal baby, is complete. And we call it a zygote. Okay. That's the first. And then the cells multiply and divide. Okay. It grows, it becomes a morula. All the while, as it's growing and multiplying, it's moving. There's a current in the fallopian tubes. Okay, it's drawing that conceptus or that zygote, that morula, and it becomes a blastocyst. It's drawing it into the uterus. And then what happens to the blastocyst?
Implantation.
Implantation. So it's implanted into the wall where I told you all those blood vessels are, right? It's called the endometrium. So it implants inside the endometrium. It's surrounded by a vast amount of rich red blood cells. Okay. And so it can bring oxygen and nutrition. And actually, it takes a few weeks before the placenta is actually functioning well. So it relies on the yolk sac, okay, and mom's fluids to develop. Okay. So it implants in the endometrium. Okay. And the placenta forms, and the placenta is mature about week 12. All right. So that is your physiology, your reproductive cycle. Um, what about anything else? Do you understand the GTPAL or Nagel's rule yet? You'll need to know those. So you could kind of look at it. And then
I'm sorry, can you
let's see.
repeat that? That was the GTL and the what? I'm sorry.
When we do an interview of a patient, when
Mm-hmm.
we interview her when she comes in to prenatal care, we've stressed how important it is for prenatal care and early prenatal care. We interview her and talk to her about her background. Okay. So, what were we saying? I forget. What did you ask me?
Oh, sorry. I was just asking you to repeat those two things. It was the
Oh, okay. Oh, yeah. And when we do her history, yeah, the GTPAL, we get her obstetric history. We want to know how many times she's become pregnant, how many babies has she delivered, how many children does she have, did she have any abortions? And we used abbreviations. It's called GTPAL. The G stands for gravida. The GTP, T stands for full term pregnancy. P stands for preterm pregnancy. So you can review those. We're going to be talking about those kinds of things this week. So if you have time before class this week, and those of you in your Monday class, you'd have to do it tonight or tomorrow morning. Watch the pre-recorded lecture. So
Is
you
that
will be,
around like what the 2 questions on a quiz would be about?
I can't tell you that.
On
I
the
can't.
DTPAL, so for the abortion part, if the baby doesn't, so if it's under 20 weeks, that's considered still an abortion,
Yeah. The word
even if it's a
abortion,
miscarriage.
same thing. The pregnancy was aborted either because of
Okay.
a physical problem, the baby just was so abnormal, or there was an exposure to something, or she terminated the pregnancy. It's all still considered an abortion.
Okay.
Yeah, miscarriage, we use the terms back and forth. Okay, miscarriage, abortion, same thing. Okay. All right. And then Nagel's rule, then we would, in our discussion, in our interview, we would determine when her baby's delivery day would be approximately. And we use the first day of her last menstrual period. So those two terms are ones that you can look up but I would just recommend that you watch the pre-recorded lectures. That will help you do really well on the quiz. Okay. All right. All right. Math. Our math, OB, has everybody done their OB calculations?
Yes.
yes.
Okay. There's one question on there that the answer was keyed incorrectly. So there's one that we have to adjust. So if you get a 10 on your OB calculations and then you notice it went up to 11, or maybe it dropped down to a 9, it's because we're had to manually go in there and grade those. Okay. So there was an error on the OB calculations. So just to kind of explain that to you. As far as what you need to understand is rounding. Um, and you know that probably half of all calculation errors is not reading the question carefully. Okay, so let's talk about some of these things. So rounding. This is in the math PowerPoint I posted. You need to know your conversions as well. So on the left side, it shows you 2 pounds is 1 kilogram. Don't Google these because there's too much of an error. Most students who try to Google their calculations will make mistakes. So you need to know that 2.2 pounds is a kilogram. And then your conversions in the grams to kilogram, milligrams to grams, micrograms to milligrams. It's simply moving the decimal point. If you're going from a microgram to a milligram, you're going to move your decimal point 3 spaces to the left. If you're going from a microgram to a gram, you're going to move 6 spaces to the left. If you're going from a gram to a milligram, you're going to move the other direction. Okay. And it has to be 3 spaces. If you're moving from milligram to gram, you're moving 3 spaces. If you're moving from milligram to gram, I'm sorry, microgram to gram, you're going to have to do it twice. Does that make sense? Don't let the word milliunit throw you off. It's just like another milligram. And we always write out the word milliunit. And a drug called oxytocin is always prescribed milliunits per minute. Okay, that's the only drug I know of. Well, there are some cardiac drugs that are dosed per minute. Okay, and then 5 ml is 1 teaspoon, 15 ml is a tablespoon, 30 ml is an ounce, and then 240 would be a cup or 8 ounces. All right, so rounding. I kind of have this chart at the top in white memorized. You notice if it's a whole number, we do not use a decimal point. You don't put 2.0 because that's oftentimes will cause errors. So the only time you would use a decimal point is if the number is below 1. Okay, so the tenths column is the very first space beyond the decimal point, and then the hundreds and the thousands. Okay, so if we're rounding to the nearest tenth, we're looking at the 100 space. So in this example, 3.67, that 7 is in the hundreds place, and because it's 5 or greater, we're going to round up in the tenth space. So instead of 3.67, it's going to be 3.7. And then if it's less than 5, we're going to leave it alone. We're not going to round up. If in this example down below, this is rounding to the nearest 100th space. And so you're going to look at the thousandth space and determine, is that number 5 or more? Well, in this example, it's less than 5, so we're going to leave the 7 at 7. Okay, 3.673 is rounding to the hundredth would be 3.67. So you need to know that. Okay, so some suggestions with math. Sometimes you'll come read a math problem and you're thinking, oh my gosh, how in the world do I solve that? Well, if there's a lot of units of measure or a lot of numbers in it, think about it as doing it in steps. First and very most important is to read the problem at least twice to really understand what is it asking you? What is it asking you? Once you know what you're looking for, then you need to go ahead and perform all your conversions. Move everything to the metric system. Move your ounces to mLs. Okay. Your pounds to kilograms. Get them all in the metric system. Okay. And then once you've got apples to apples, if your question is it gives you a milligram, 10 milligrams, and yet they want the answer in grams. Keep that in mind, okay? If you've got two different, a gram and a milligram in the problem, then you want to either choose milligram for both of them, convert the gram into milligrams, or vice versa, okay? And then step 3 would just be setting up the formula. Step 4 would be rounding according to the questions. You're not going to round early. You're going to wait and do all your calculations. Don't do any rounding until you get to the very end. And then you're not going to round unless you're told to round. So that's really important. It's like having, okay, I know step 1, I need to do this and this and this and this. And that will help you if you have a really complicated problem like this one. So, and you will have one similar to this on the first exam. So you were a nursery registered nurse. You're working in with preterm babies. And some of these preterm babies don't drink any more than maybe a half an ounce at a feeding. Not much. Their tummies are so tiny. Okay. So the provider wants this baby to consume so many mLs. So let's see. So the first thing, we want to know how many calories. What did I do? Mess this up. Let's see here. Okay. Let me move this up. Okay. So, no, that's not right. Gosh. I got that mixed up. I need to fix that. All right. All right. So the order is to give this baby 45 milliliters, and it's not in here. I am so sorry I messed this up. Let's see what I did here. Okay. The order is feed preterm baby, preterm newborn, 45 mLs of formula every 2 hours. And it tells you that the formula contains 28 calories per ounce. Okay. So in this problem, the first step, of course, is to read the problem. So we need a volume of a formula every 2 hours. The question is, how many calories will each feeding contain? If you have 45 mLs and you have 28 calories per ounce. So let's do conversions first. Okay, so we have 45 mLs and we have 28 calories per ounce. So let's change the ounces to mLs. Okay, and so how would you do that?
Would you multiply by 30?
Okay, yeah, multiply by 30. So 30 1 ounce equals 30 ml. Okay, so how many feedings then does each how many calories does each feeding contain? So how you would set this up is calories over the volume times the number of feedings. Okay, so calories per volume. Do you know what kind of formula you would set up for that? Let's see. Do I have it? Here we go. Okay, if you have 28 calories in 30 mLs. That's what the formula, I mean, that's what the baby formula is. But we want to give our baby oops, 45 mLs. And this would tell you how much each feeding contains, how many calories. Do you know how to work this kind of a problem? Anybody? Do you know how to work this problem?
No, ma'am.
You're gonna do cross multiply because 28 times 45 equals 30 times x. 30 times x. They're equal, okay? This is the same amount as this. So you're going to multiply and divide, okay? 28 times 45 is the same thing as 30 times x. So let's do it this way. 28 times 45 divided by let's see, 28 times 45 divided by 30. Okay. I'm not doing a very good job here. Okay, so we're going to multiply 28 by 45 and divide it by 30. And that tells you how many calories for every time you feed the baby. So you're going to feed the baby every 2 hours. So we're going to give 45, and then we forgot how many calories. Anybody know?
Is it 42?
42.
28 times 45 divided by 30. It's 42 calories. So every time you feed the baby, you're giving the baby 42 calories. Okay? So now the next step would be 42 calories every 2 hours. So if you're giving it every 2 hours, how many times would you be giving it in 24?
12?
Yeah.
Hmm.
So you multiply that by 12. And what do you get?
504.
Yep, 504 total calories. I didn't mean to, I'm sorry, that's so confusing. If you look in the PowerPoint, it's correct. Okay. So you noticed we had to do several steps. We had to read it well. We had to convert the ounces to ml and then plug in the formula. Okay. And the formula is right here. Calories over ml that we know that we're told. We're told that there's 28 calories per 30 ml. But we need to give 45. So what do we need? We know what we have, we know what we need. So set up that formula and do your cross, multiply, and divide. Okay.
So is it
All
gonna be
right.
like that type of math question that's on the quiz tomorrow?
No, that's not on the quiz tomorrow, but it will be on the exam.
Okay.
Okay. So also remember these formulas. Put them on a post-it note or some kind of scrap and just tape it to something and memorize it. and this was on your OB calculations, you were given a volume and you had to give it over a certain amount of time. A lot of times when we do a bolus, we run infusions quickly. So if you've got 100 mLs and the provider says get it in 20 minutes, then you've got to multiply it times 3. Okay, 300. Okay, you got to multiply it by 3 because there's 3 20s in an hour. Okay, so what you do is put the volume that's ordered, the 100 ml, and then the 20 minutes below, and then your conversion factor is 60 minutes over an hour. You want those two to equal, and that will give you your infusion rate. So this is actually equals. Okay, that would give you your infusion rate. Okay. Actually, this is right because it's below. So solution amount of medications then. Would be if you're given an IV bag and there's 2 grams of Ancef in it, and you're also told get it in 20 minutes. And that's how you would set this one up. So when you have a certain amount of medications. Okay. All right. Did you follow me? Now, let's see. I'm looking at the people here. And believe it or not, Meredith, you are all Nicholson. Yeah, you were all my students, right? Shanna Nicholson. Shanna, what's your other first name?
Shayna Rutley.
Rutley. You're not my student?
No, ma'am.
Okay. Okay. Who's your instructor?
Leanne.
Who?
Leanne Young.
Oh, Professor Young. And Karina, who's your instructor?
Dr. Clean, is it? Wait, let me double check.
Dr. Roberts?
Oh, wait, she's
That's okay. Well, you're not my student.
no.
And I know that they have given you math PowerPoints too. But if you want me to send this one with the calorie one on it, I will.
Okay, thank you.
Just let me know. Okay. Anything else you want to discuss or ask me? Anything at all? Does
It's
everybody
actually
understand?
Patricia Klein is my professor.
Oh, Professor Klein. Okay.
Yes.
All
Yeah.
right. All right. Gotcha. Gotcha. Okay. All right. Anything else you all need help with? All right.
Oh, sorry, I have a question.
Yes, Natalie.
So do you think that if we just focus mainly on like the fertilization and conception and all of that, we should be good for our quiz? Yeah.
Yeah. Yeah.
Okay. Cool. Thank you so much. I appreciate it.
You're welcome. You're welcome. You're welcome. All right. Thank you, everybody. Next week, next Sunday night, we're doing a case on an adolescent, and we're going to go over JTPAL, and we're going to go over all that stuff next week, just as a review. Okay. All right. You all have a good week. Okay.
Thank you.
Thank you.
Thank you so much.
Welcome.